Hi, everyone. My name is Ryan McGuire. I think I'm familiar with most of you from previous work at the health department. I'll just be nice and brief talking about the state of COVID-19 in Alachua County. So as we all know, the state of Florida has changed our reporting from daily to weekly. So all of our data as of last Friday, August 6th. So we have just over 29,000 confirmed cases. Our positivity for all cases over test is about 14%. And we have about 285 deaths confirmed for Florida residents. I say confirmed because the state health system is in the process of verifying those deaths, so that number is subject to change. Last week, we had about 1,400 new cases with just about 14.6% positivity, 519 cases per 100,000 residents. Obviously, these numbers are trending poorly, as we can see throughout the year 2021. We are at the highest point when it comes at new cases per capita. We really started to see this surge in the end of June, early July, start to pick up steam. To put this in context for the entire pandemic, here's cases by the week since March of 2020. So as it looks now, we are sort of surpassing our previous peaks, which were around the winter and then last summer as well. As far as those people who are being tested, more and more are coming back positive. So again, with last week about 15% positivity, that means more people that are going in for these tests are coming back as positive and are sick. You just heard from Mark Sexton about the revitalization of our COVID dashboard and sharing some information from the hospitals. Alachua County following these local and national trends where most people hospitalized with COVID are not vaccinated. And we do have a slight increase in pediatric hospitalizations. We want to take that very seriously. This is from the Florida Hospital Association comparing hospitalizations for this year versus all 2020. So as we can say, at a statewide level, we are much higher than we were at the peak last year. In terms of our vaccinations for the county, we have about 147,000 people vaccinated, which is 61% of those 12 and over. Last week, we had just over 3,000 vaccinations. So we had very good progress early on. It has tapered off in the last few weeks, but hopefully as more and more people are seeing that this is a real serious problem again, and still with us, that those vaccinations will continue to increase. When it comes to getting a good proportion of our population vaccinated, we still have a ways to go. Alachua County is doing well, all things considered, compared to the rest of the state, but we need another 20 or 30,000 people if we want to hit that 70-75% herd immunity vaccination rate. Based on age groups, obviously the 12 to 17-year-olds, it's a little bit more recent as far as vaccine availability. So we have about 5,800 people fully vaccinated. For 18 and up, 133,000. And then our older populations, we are doing very well in terms of the majority of them having at least one dose. Alachua County rates in the upper quarter of all the counties in Florida as far as our eligible vaccinated population, and we are in the bottom quarter for the lowest rate of cases per capita, which just means that as far as COVID-19 spreading, it is not spreading as severely in Alachua County as some other places in the state. We all know today just started the first day of school for public students in Alachua County. Just a reminder that the health department is working with our school board and all of our schools to have staff in every school. We are going to be doing testing, contact tracing, hosting clinics in the schools for those students that are eligible, and just continuing with the COVID-19 related efforts just like we did last school year. In addition to our flu miss program in the schools, we will be having COVID-19 vaccinations. So just be on the lookout, or if you speak to any parents and families, remind them that this will be coming to their school and to take advantage of that. And people should not forget the flu season is here. We want people to be doing the flu miss or flu vaccines as well in our community. So the biggest news I have is that the health department is going to be expanding testing and vaccinations. So as of this Thursday, August 12th, we will be open 7 days a week for testing and vaccines. We'll be doing the morning time slot for appointments, and you can call our main line 334-8810 for appointments. And then we will be doing walk-ins from 12 to 7 p.m. and on the weekends, 7 a.m. to 7 p.m. So this is because of a need in our community. More and more people are either being exposed or being symptomatic. We want to make sure we keep those people safe and have more access to the COVID-19 vaccines. For our other clinics, we are doing it by appointment only. For the Southwest Clinic, Mondays and Thursdays from 9 to 3. In the Alachua Clinic, Tuesdays and Fridays, 9 to 3. I'd be happy to share this with Mark, and he can share this on the website in the Facebook for the county. And then just to wrap up, just a really quick reminder, we know that there are tons of benefits to the COVID-19 vaccine that far outweigh any potential risks. We are seeing, excuse me, millions and millions of people getting these vaccines and staying safe. As was said earlier, most people in our local hospitals with COVID-19 are those who are not vaccinated. This follows a national trend that every single state is seeing. So honestly, the data is there to show that this is a great intervention for us to use. And then just one little friendly reminder that this is not going away anytime soon. Continue to do your standard public health practices, get vaccinated, wear a mask, wash your hands, do social distancing, avoiding super crowded areas, and then just doing those basic common sense things that we all were doing last year. The vaccines are making a huge difference, but don't forget the other things that worked as well. And then I'll go ahead and wrap up there. Thank you.
Thank you, Ryan. Can you sit tight to allow the public comment for questions?
Yes.
Okay, Dr. Lizardo, you have the floor. Thank you for, first of all, thank you for being here on such short notice. You're on mute.
All right, well, thank you. Yeah, it's an honor to be here. Thank you very much, Chairman Cornell, to invite me back again today to present. And good day, everybody. You know, I think I've always am hesitant to kind of share not so great news, right? I think you saw the numbers that are there, but those numbers can be cold numbers that they're depersonalized. But take one walk through the hospital, one walk through the ICU, and you can see the real impact that this is taking. Many people are now knowing people personally that are losing loved ones to COVID, that are experiencing severe COVID, and understanding the gravity of what's going on. But still, we still have a communication issue to be able to communicate to folks to really understand what their concerns are about getting the vaccine. Again, much is said about those that are kind of take more extremist views in terms of vaccines, but the majority of people who've not been vaccinated are very reasonable people who really need to have their questions answered and to address things. But again, we're just going to continue to present the facts as we know them. Vaccines are our only way out of this. And as you can see, we're in a bind and we're in a bad spot. You can say, well, vaccines have been available. If they're so effective, why are we having such a big problem? Because we never made it to herd immunity. It's almost as if we intercepted the ball in the end zone with the last minute to go. We were running it back for a touchdown and we decided to spike the ball on the 5-yard line because we didn't finish. We didn't get everybody vaccinated that we needed to. And again, we all pay the consequences for that. Again, we are in this together, and we as Americans are rugged individualists, right? We pave our own way, we pull ourselves up by our bootstraps. But the reality is that in the face of a pandemic, we have to all work together. And that means getting everybody vaccinated as much as we can and to address the concerns that people have. And we as a medical community really need to address those concerns so that we can ensure that we get enough people vaccinated. Again, when things are as bad as they are right now, and again, I am an optimist to the core, but I'm also a realist. I'm not going to sugarcoat things and tell you things are wonderful and great. We will find a way through this. We will do the right thing eventually and get past this. But the fact of the matter is that we are at a state right now where things are incredibly complicated in terms of medical care. Hospitals are scaling back elective procedures. In Jacksonville, it is going to be quite possible that they will run out of ICU beds in about a week, where if you have any other medical problem, you will not be able to get care. We're not quite there here in Gainesville, but still the system is taxed and we're limiting outpatient surgeries. The emergency rooms, everybody's taxed to their limit. So what's the answer? What do we do now? How do we stop this? We're trying to get people vaccinated. We're making vaccines more and more available. We're reaching out to people and communicating like we never have before. But also there's that next step, and that is that indoor masking is something that, and from a medical standpoint and a public health standpoint, is absolutely essential. And you can say, well, if we've got so many people vaccinated, why should vaccinated people wear a mask? Well, here I use my umbrella analogy. And to me, it's like when it's just raining lightly or even just a moderate rain, and you go out with an umbrella, it'll keep you dry. It'll work beautifully. But if you're in a heavy afternoon Florida thunderstorm, or if you're in a tropical storm, you need more than an umbrella to stay dry. You're gonna need a raincoat. You're gonna need to avoid going outside unless you wanna get wet. So right now, we're in a rainstorm. We are in a downpour. We're in a tropical storm version And for us to stay dry, you not only need your umbrella, but you also need to have a raincoat and avoid exposures to large numbers of people. Look, our children need to be in classrooms and learning in person. They need that. We need to have our economy open, and we need to do those things. I, as a physician, know that the things that I recommend medically, the prescriptions that I wrote this morning in my clinic, the procedures that I recommend people to undergo, they all have a downside to them. And I recognize that, and that's no different with COVID as well. But when you balance the good with the benefit or the inconvenience versus the life-saving moves of vaccines and the life-saving move of masking up while indoors, it's incredibly important. So in other words, we need to use all the tools at our disposal because they work. We've got to get that last, as Ryan mentioned earlier from his excellent presentation and giving us the facts, if we get that last 20, 30,000, we push further, we can limit our risk, we can actually start to save lives. Not wearing masks will cost lives, period. Not getting vaccinated will cost lives. And here's the thing, is that because there are large numbers of people that are still unvaccinated, over close to 40% have not been vaccinated in Alachua County. The rest of the population that has been vaccinated is at risk. Why? Because now we're dealing with Delta. Delta is not just an airline, right? Delta is now this new variant that actually has changed, where it spreads much faster, much more efficiently, and cruelly affects younger people, unlike the previous variants have done before. So in other words, our freedom to not get vaccinated, our freedom to not mask, is accompanied by a responsibility to those around us. So again, if you've got to care for those around you as well. And with that, had we all gotten vaccinated, had we all kept everything in place we would have been done in May or June. But that's okay. We'll learn, we'll do the right thing, and we'll keep moving things forward. But again, the key here is for us to continue to move in this direction so that we can just end this pandemic because we have the tools. Because as I'm afraid that my colleague, Dr. Salemi, will share here in a moment, this virus continues to mutate. And again, it's not theoretical anymore. The virus mutated to a more dangerous form that's more infectious and easily spread and now affects younger people in their 30s and 40s. I believe 25% of the patients that are in our hospital right now are in their 30s or younger. This is very different than the situation was a year ago. So again, I think that what we need to do at this stage, absolutely, positively, need to use all the tools at our disposal, continue to be open, continue to be wise about that because the tools work in those situations. But again, in the absence of getting more people vaccinated so we can finally end this, we need to move forward. And for those who are on the fence and considering about getting vaccines, please call us. We'll help answer your questions. And many of those questions are very legitimate, very, very sincere questions that we need to do a better job at answering and make those vaccines available to you, help you get through and make the decisions so that we as a community can get fully back to normal and have fewer people super sick, fewer people in the hospital, fewer people dying.
We'll go ahead and now give the floor to you, Dr. Salemi. If you could introduce yourself and your credentials for those of us that don't know you and the public out there, and then take 4 to 6 minutes, whatever you feel is necessary, and then we'll open it up. I'm sure there'll be many questions for you. Go ahead, you're recognized.
Thank you, Commissioner, and thank you everybody for inviting me and giving me the opportunity to be of service of my community. I'm Dr. Salemi. I am a professor of experimental pathology at the University of Florida College of Medicine. I'm also a primary investigator at the Emerging Pathogen Institute at the University of Florida. And over the past year and a half, as a research scientist, I've been actually monitoring the spread of coronavirus. My major work is in epidemiology and molecular epidemiology. So my lab and my group specifically focuses on tracking SARS-CoV-2 variants, the emergence of new variants, their spread, and assess, of course, how dangerous potentially they are. Unfortunately, I have to echo what my colleague, Dr. Lizardo, just said. We are definitely in the midst of a tropical storm. And let me be clear about this. The decisions that we are going to make as a community and hopefully as a state and as a country over the past few weeks or a few months will determine whether this tropical storm will become a category 4, a hurricane, or something that in fact can be contained. There is no doubt that we are experiencing a dramatic new surge of coronavirus. And again, let me be very clear about this point, because we have heard many things on the news and from political commentators and so forth. This is not what we're seeing right now. It's not, and I want to be very, very clear about this, some kind of seasonal surge, something that it can be expected by an epidemic that, you know, comes and goes. This is a new phenomenon that we're seeing, and hopefully my data will clarify this point. Coronavirus, as any other virus, mutates, continuously mutates, can mutate pretty fast. And the more the virus circulates in the population, the more it accumulates mutations. And the results of these mutations has been the development and the emergence over the past year and a half of several variants. The latest variants that we are seeing circulating now is the Delta variant, which is more aggressive, more infectious, potentially, possibly more pathogenic, although on the pathogenicity there are no definitive data yet, but certainly we are seeing a surge in terms of hospitalization and a surge, as Dr. Lizardo was saying, in terms of younger patients being hospitalized. When we talk about herd immunity, we have to be very careful about this. As an epidemiologist and someone who has studied the evolution and the molecular evolution of viruses for, you know, almost 30 years now, I can say that it is my opinion, founded on the facts that we have and the empirical evidence that we have, that herd immunity for coronavirus is something that will be very hard to achieve, if even that is possible. This is what we know. First of all, people that get infected and survive the infection do develop immunity, of course, but this immunity doesn't last forever. In fact, there have been many cases of reinfections. There have been dramatic outbreaks. The last one that is very well documented was a few months ago in Brazil, where an entire town where more than 80% were infected last year started experiencing a new surge of coronavirus because, in fact, the immunity was waning down. Vaccine protection also is very effective until now. But again, vaccine protection doesn't last forever. On top of that, people that are vaccinated can still get infected, of course, with milder symptoms, at least right now, and they can still potentially transmit the virus. And again, as I said at the beginning, the more the virus circulates in the population, the more it keeps mutating, and the more is the likelihood that new variants, new and more aggressive variants will come out. So I can't stress enough, as already Dr. Lauzardo said, that not only vaccination is so important, because vaccination limits certainly the amount of virus that circulate in the population. It doesn't abolish it, but it limits it significantly. And of course, not just vaccination, but mask use, social distancing. These measures are crucial, especially now, not only because 40% of the population is still unvaccinated in our county and even more of that at the state level, but because, as I said, people that are vaccinated can get infected, albeit probably at a lower rate, and can still transmit the virus. So these two intervention, vaccination and public health measures must come hand in hand. You know, one of the proudest and happiest moments of my life has been many years ago when I took an oath and I swore to become a U.S. citizen. And the thing that I love about this country is the attention for personal freedom, for our ability to really be allowed as individual to have self-determination is a value that I cheer above anything else. At the same time, in an epidemic like this, we cannot hope to contain it and to be safe unless we stand united, unless we adopt measures that each one of us must have the responsibility and feel the duty to carry out, because we are all in this, you know, in this all together. So let me show you some of our most recent data. The University of Florida has been, as I said, monitoring the spread of variants since the beginning of this year through a network that includes right now Alachua County, and we have also samples coming from Lee County and Miami-Dade. but most of our samples are around Alachua. We have developed a very quick system to sequence the virus and to actually assess the variant that is circulating in the population. We are currently sequencing around 600 sequences from positive cases per week. Potentially, we can go to a much higher number if it is required. So definitely, we have an operation ongoing that allows us to have a very good and quick eye and provide a quick assessment of what's going on in terms of variant circulations. So what has been happening in Alachua specifically over the past, since the beginning of the year? So at the beginning of this year, in January, about 98%, virtually the majority of the cases were due to the so-called B1 variants and subvariants. These are not what CDC called variants of concern. These are other variants of the virus that were not associated to any particular increased infectivity. In February, we began to observe about 10% of the variants circulating in Alachua belonging to the so-called Alpha variant, a variant that was first described in UK that has been, in fact, associated with higher infectivity. And the Alpha variant rapidly took over, becoming the majority variant circulating in March and April. At the same time, as you can see down here, the N represents the number of people that were actually sequenced, and so for which we do have the variant that was infecting these patients, which are not the old patients that were infected in Alachua County, but represented about 60 to 70% of them. So it's a good representative sample. The number of individuals have been going down. We knew the epidemic seemed to be, at least for a short time, under control. And then this is what happened, unfortunately, in the last 3 months. The Alpha variant numbers start decreasing. We had a surge between May and June of another variant called Gamma, which is more infectious. And then in June, so really in the past couple of months, is when what we are seeing right today started happening. We started detecting the first cases of Delta variant. They were only 6%. And as you can see, in June, we had very few cases overall, 47 for which we had the sequencing done, which were not many, not far away from the actual total number of cases. Suddenly, we had a significant spike in July, and the Delta variant cases jumped to 6% to 42%. This is what we knew until the end of July. We update our statistics every week. We have a new sequencing done every week, so I will have new results actually next week. And right now, these data are posted online on the Emerging Pathogen Institute website and updated weekly, so for everybody to be able to access them. We expect, unfortunately, that this 42% will significantly go up. What we have seen here in Alachua, so this sudden spike, both in number of infections and number of Delta variants, basically reflect what's going on all over Florida. And let me show you this one last slide that is, for me, the most concerning one. We have been tracking vaccine breakthrough cases. Vaccine breakthrough cases are those cases where people that are fully vaccinated got nevertheless infected. Now, as it has been said by my distinguished colleagues in the earlier on, the number of vaccine breakthroughs is still relatively low. So luckily, at least for now, there is no evidence that the vaccine is really not being an effective protection. However, we have seen a certain trend in increase overall in numbers of vaccinated people that get infected. And when we specifically look at which variants these vaccinated people, with which variants these vaccinated people are infected, then you can see, essentially since February till the middle of July, we basically analyzed about 20 cases of vaccine breakthroughs, very few. A lot of different variants were found in these patients, nothing of particular concern. Literally, in the last 2 weeks, suddenly we identified and analyzed 51 more cases, so more than twice to what has been found in the previous months, virtually all of them infected with the Delta variant. So this is the situation right now. As I said, it's a daring situation. It's a situation that can get much worse. Vaccination definitely is the key. Now, there has been talk, and there is continuous talk, is the vaccine really effective? What is the point of vaccinating if people that are vaccinated can be infected? Maybe the virus is developing resistance to vaccine. Well, the virus might very well mutate to a point that we will need a new vaccine. We are not there yet, but the mutational pattern of the virus seems to be moving in that direction. How do we slow it down? Well, by increasing the number of people that are vaccinated and by having mask and social distancing measures in place. I say it again, the more the virus circulates, the more it accumulates mutations, the more likely becomes that we will have even a more aggressive variant or a vaccine-resistant variant in the next future. So it is absolutely paramount that we keep monitoring the situation and that we understand, all of us together as people. I have 2 young kids in school right now, in kindergarten and daycare. And I am, as a parent, very much concerned because the virus is circulating more and more, and because we need to be understanding that, again, this is not a seasonal, variation that is expected. This is a new game. It's a new game caused by the fact that, unfortunately, we have been the coronavirus since the beginning has been a moving target. We've been trying to enact safety precautions, mask mandates, social distancing, and eventually we developed a vaccine. We started vaccinating the people, but the virus seems still to be one step ahead of us. So right now, more than ever, is paramount, in my opinion, as a scientist and as a citizen, that we really implement all the necessary measures to start curbing this epidemic.